Is your jaw pain persisting? Are you having headaches from the back of your head up over your ears, temples to the eye area? It can come from tiny muscles just below the back of your head called the suboccipital muscles. These cause a great deal of pain and dysfunction for the tiny size of them. They help to control how your head sits on top of your spine. They're connected to the function of your eyes and the writing reflexes, which help to keep your eyes on the horizon. We can even use our eyes to help stretch these muscles. Place your hand on the neck and just back of the head and feel this area. Hold your head still and look up with your eyes. Look down. And you may feel a little change in that area. To make it more noticeable, you can feel it a little easier if you look up and tilt your head down, tilt it. Can you feel that? Just move it just a titch. If you can't feel it, it doesn't matter. Your nervous system knows what it's doing and it's going to work automatically. I think of these muscles as similar to the rotator cuff in the shoulder. They are for fine motion adjustments and stabilizing the head, not for big motions. They will complain and act up when you ask too much of them. If you have a forward head posture, these tissues will become shortened and tight. We need to address why you have this forward head posture eventually, but in the short term, we can get some relief now by doing different stretches and some self-massage. Remember that these muscles are small and do not require much force or pressure. Going easy on them will give you better results. I appreciate you're probably in pain right now and you want results right now. However, the body often takes a little bit of time to process and integrate, so please don't overdo it. To stretch these, sit tall with your head towards the ceiling. Now we're going to roll our head like an orange on a toothpick, just like the ball of our head rolling. And we do this by doing a chin tuck, by pressing our chin back. But instead of pressing your chin, press on the upper jaw below your nose with the web of your hand. This gives a much better fulcrum for your head to move on the spine without jamming up your temporomandibular joints or your jaw joints. Press your head backwards gently under your nose and see if you can feel the upper back of your neck open up. Look down with your eyes. We want to feel a gentle stretch without pain. This is the orange on the toothpick. We want to hold this backwards pressure throughout the complete stretching motions. Using your other hand, grasp the top back of your head and bring your head down and forwards, tipping your head towards your chest. Keep your eyes looking down. Aim for a light, gentle stretch. Back it off if you feel pain. And we're going to hold this for 20 to 30 seconds. These are small muscles and are located between the top two vertebrae, called the C1 and the C2, and the skull. Rectus capitis posterior minor goes from the top vertebra, or C1, up to the skull and is mostly an extender, or a muscle that makes you roll your head back and look up a little. This is the orange moving on the toothpick backwards. Its big brother is a rectus capitis posterior major and goes from C2, or the second vertebra, up to the skull, just to the outside or lateral where the minor attaches. This means it extends and also rotates the skull a little. Another rotator is the obliquus capitis inferior, which goes from C2 to C1. We also have the obliquus capitis superior, an extender and side bender of the head. Because of the orientation and the function of these muscles, we need to rotate the head a little to affect them all. If you have more discomfort on one side of the neck, we will make the same motion as above, going forwards, but we will just turn the head slightly towards the opposite side of the painful side. If you're experiencing some pain at the right top back of the neck, jaw, face, and head, then we will look to the left about 30 to 45 degrees. Push under the nose, pressing the head backwards and looking down, making the orange on the toothpick motion, and tip the whole head and neck towards the chest using the other hand. Remember to go gently. These are small muscles. Hold here for 20 to 30 seconds. Even if you have pain only on one side, I recommend stretching both sides. Rotate your head right, press back, and bring your head and neck towards your chest while looking down. Hold for 20 to 30 seconds. Repeat the straight forward to the left and right several times a day. I really like contract relax stretches because they can get in there deeper than we can with our fingers. Research shows this type of maneuver can have significant increases in muscle range of motion. We'll want to do it several times throughout the day to have the best impact and create lasting effects. We'll do the same setup as the stretch we just did and then add the resistance. Sit tall, press your head back, roll your eyes to look down, and then bring your head and neck straight down towards your chest. Feel the light stretch. This is the relax part. Press the back of your head into your hand on the back of your head to contract the suboccipital muscles at the back, top of the neck, and look up with your eyes. This is a light pressure, and if you're shaking or vibrating, you're pressing too much. Contract for about 5 to 6 seconds. Now relax. Look down and stretch your head and neck towards your chest for 5 to 6 seconds, the relax phase. This is one cycle. Repeat the whole cycle 3 to 5 times, ending with the relax phase. This signals the end of the contract, relax, stretch to your body. Do the oblique muscles next. Look to the left, press your head back, and to the right slightly. Look down and bring your head and neck forwards. Press backwards while looking up with your eyes 5 to 6 seconds. Relax, look down, stretching your head and neck for 5 to 6 seconds. That's the one cycle. Repeat 3 to 5 times, ending with a sustained stretch while looking down for 20 to 30 seconds. Rotate right, press your head back, look down, and stretch forward and down. Press back and slightly left while rolling the eyes up. Hold 5 to 6 seconds. Repeat 3 to 5 times, ending with the prolonged stretch. Do all 3 directions several times a day. To do self-massage to the suboccipital muscles, we have to press through a great deal of bulk of other muscles, such as the splenius capitis and upper trapezius muscles, making it almost impossible for us to reach them. But we're going to try anyways. Grasp your head with your fingers interlaced and your thumbs pointing down. The thumbs should rest just beside the big columns of muscle running up the back of the neck to the head. We'll massage the tissue in this area up and down, back and forth, and do circles. We can slightly tip our head backwards and forwards to work our thumbs underneath the ledge at the back of our skull. This is where we're aiming for. Even though we probably aren't going to get to the suboccipital muscles themselves, we are going to influence all of the tissues in the area for the better. The skin, connective tissue, fascia, and muscles in this area. We can have a very good result, reducing the amount of irritation to the occipital nerve, which can cause headaches in the neck and back of the head. Spend a few minutes total per side pressing and massaging at any one time. It's not necessary or recommended that you spend more time than that on any one area. The suboccipital muscles get a lot of attention. However, these tiny little muscles are deep in the neck and are very challenging to influence externally. We may need a combination of stretching and manual work to influence them. Try a combination and let me know if it helps. Stretching and self-massage to the suboccipitals, sternocleidomastoid, and upper trapezius can greatly reduce your neck tension and headaches that lead to jaw pain. Do the stretches 3 to 5 times a day. 3 to 5 times a day, and massage them lightly for a few minutes a day. You will feel a decrease in your symptoms in 10 to 14 days.